we're joined here by Nathan and Bryan. Nathan, welcome to the GPCME here in Rotorua.
Thank you very much.
Now, you've done a number of talks today, or actually yesterday and today, but it was around the topic of nitric oxide, which has actually been really interesting. I've managed to attend pretty much most of them to try and get my head around the scientific organic chemistry perspective of it, but we've only got 5 minutes to kind of summarise what you talked about. So I just want to open with one of the quotes that you had. You talked about a man is as old as his arteries. And you talked about as we age, we lose the ability to make nitric oxide, but you never lose the ability to respond to it.
Correct.
Is that right? So I guess my first question to ask is, how is nitric oxide a vascular protective factor?
Well, the 140,000 scientific papers on nitric oxide tell us that every known risk factor for cardiovascular disease, even from the onset of vascular disease to an acute MI, is all dependent upon nitric oxide. So all the vascular protective effects that we know in vascular biology are mediated by nitric oxide, whether that's preventing the vascular inflammation, the earliest events in the onset and progression of vascular disease, or if it's a heightened state of inflammation in patients with advanced disease, then these white blood cells, platelets begin to stick to the lining of the blood vessel, plaque becomes unstable, it ruptures. All this is a result of insufficient nitric oxide production. So it's known that if we can restore or prevent loss of nitric oxide production, we can prevent cardiovascular disease, the number one killer of men and women worldwide.
Okay. So you're saying that if we can enhance nitric oxide in our heart, we could ultimately protect ourselves from having myocardial infarctions and things like that in the future?
Sure. Well, I think it extends beyond the heart. The cardiovascular system perfuses all tissues, so it's relevant to stroke. It's relevant for erectile dysfunction, because if there's dysfunction in the blood vessels that are feeding the heart, there's dysfunction in the blood vessels feeding the brain. And so most, if not all, of the basic science data suggests that if you have insufficient nitric oxide production, you're more prone to heart attack and stroke. And if you have heart attack and stroke, the resulting injury is more severe. Okay. And to the contrary, if you restore nitric oxide production or take effective strategies to prevent loss of NO, then you're at less risk for heart attack and stroke. And if you do, there's less injury to the heart and brain.
So what you're saying is if we enhance nitric oxide levels in our body, can we ultimately protect ourselves from having like heart attacks or myocardial infarctions?
Sure. Well, there's known safe and effective ways to do this, and it's really diet and exercise. So we know that if you, especially in young healthy people, if you begin to exercise, this leads to an activation of nitric oxide production. So this is a continual exercise program, keeps nitric oxide levels up. The problem is in older patients who've been sedentary for a number of years, if they begin to exercise, their body can't stimulate or make nitric oxide upon stimulation. So that's why they become exercise intolerant. In fact, that's why people fail on exercise stress tests if they have advanced coronary disease. The other way, and probably the most tried and true, is through diet. So consuming more green leafy vegetables, and these contain more inorganic nitrate and nitrite that are then reduced into nitric oxide. But the interesting thing we've learned about this over the past 10 years is that diet, particularly nitrate metabolism, is dependent upon oral bacteria. And so these nitrate-reducing bacteria become really critical for the use of diet as a means to enhance nitric oxide production. Because humans don't have a nitrate reductase enzymes. We're 100% dependent upon bacteria. So the oral microbiome, oral hygienic practices then become a really important factor in nitric oxide status.
And you mentioned something about chlorhexidine yesterday with the oral biome. It changes it, doesn't it?
Sure. Yeah. Well, any antiseptic strategy that removes bacteria, including antibiotics, antiseptic mouthwash, these are typically non-selective for bacteria. I mean, you're trying to get rid of pathogens, but the bacteria that live in and on our body outnumber our own human cells 10 to 1. So when you take antibiotics or you take chlorhexidine, there's an eradication of a lot of good bacteria as a kind of an unintended consequence. And when you do this, you shut down nitric oxide production, and people become at more risk for developing high blood pressure and cardiovascular disease.
Okay. So having bad breath is not necessarily a bad thing.
Well, I tell people it's better to have bad breath than to have a heart attack, but the data are clearly showing that if you eradicate oral bacteria, then you can no longer make about 50% of the body's nitric oxide, and then bad things happen.
Can I touch more on the diet side of it? Because I wrote down yesterday that I needed to eat about 150 grams of spinach to try and create enough nitric oxide in my body to be healthy. You also mentioned yesterday about fermented foods like kombucha and the Japanese kind of diets and Mediterranean diets. And you did say that those do show benefit, but what about like processed meats and things that are high in nitrates?
Yeah, I think the media has done us a disservice over the past 50 years because showing that the nitrate in cured and processed meats is unhealthy. The truth of the matter is that 85% of the nitrate we get from our diet comes from green leafy vegetables. Only 5% comes from cured and processed meats, and the other 10% comes from swallowing our own saliva. So all the epidemiological data show that green leafy vegetables, and now the data are showing that by virtue of their nitrate content, are cardioprotective. Now in cured and processed meats, there's obviously nitrite added to prevent foodborne illnesses and the overgrowth of listeria and botulism and all the bad things that we have to be concerned with food safety. But here's what I tell people: a balanced diet in moderation is always the best medicine. So I tell people you shouldn't avoid eating bacon or hot dogs, but if you include some green leafy vegetables with that, and again, balanced diet in moderation is always the best.
And you were saying earlier that you lose the ability to make the nitrate. Is there a way that we can replace it? Like, I'm trying to think of a quick fix, like an oral tablet or something like that.
Well, we've worked on that for the past 15 years because we know the problem in medicine today is that it's compliance. There's very strong evidence that certain diets can prevent disease. There's very strong evidence that moderate physical exercise can prevent disease. So these are tried and true measures. The problem is compliance. No one eats the right diet. No one gets the right amount of physical exercise. And so patients are really looking for a fix, and the society has trained us to take a pill and to have a quick fix. And so what we've worked on for the past 15 years is really a technology that overcomes a poor diet, a technology that overcomes people who aren't able to exercise. And I don't want to call it an exercise mimetic, but it leads to a stimulation and production of nitric oxide whether you exercise or not. And the other important component about the nitric oxide technology we've developed is that whether you have the right bacteria or not, we're able to create this system of nitric oxide generation independent of diet and independent of bacteria. So this technology we've had on the market in the U.S. for 7 years now really does two things. Number one, if your body can't make nitric oxide, we do it for you. But number two, and perhaps most importantly, the enzyme that becomes dysfunctional with age, we fix that enzyme. Right. So over time, we're actually able to improve the body's own ability to make nitric oxide.
Okay. So I guess one of the concerns I'd have is giving something exogenously. Can that sort of, your body wants to be lazy. Does it stop producing its own?
Yeah, it's a very important question. And you see this with testosterone and hormone replacement. If you give this therapy, it basically shuts down your body's ability to make its own. And that's certainly something we wanted to avoid. And we've demonstrated this early on, that if you provide a certain dose of nitric oxide, an exogenous source of nitric oxide, it doesn't shut down your body's own ability to make it. Now, if you go much higher, as with anything, it's dose dependent. But the amount of nitric oxide that we deliver in a single administration of our nitric oxide lozenge actually promotes endogenous NO production. We've got clinical data to demonstrate this, that a single lozenge will actually improve endogenous NO production by about 15 to 20% within 4 hours.
Fantastic. Thank you so much for coming and talking to us today, Brian.
Thank you very much.
It's been very informative.